Hi, I'm Dr. Tammy Balatgek, bringing you a series called Your Mouth is the Door to Your Health. And it's brought to you by our office called the Center for TMJ and Sleep Disorders. We have a unique office in that we share space with a massage therapist. So today I'm talking with Charise, and Charise is a friend of mine also, and we thought we'd just come to you today and share a little bit about how massage therapy can also help a TMJ problem, in addition to headaches and many other things that Charise will talk about. So Charise, would you give us your official title and explain your specialty?
Yes, thank you, Tammy. I'm a licensed massage therapist, and I'm also a certified craniosacral therapist, which I specialize in craniosacral therapy.
Craniosacral is a big word. Would you explain that to us? What does that mean?
Okay, well, the term craniosacral in craniosacral therapy involves the cranium, the skull, and the tailbone. Thus the name craniosacral. The name for the tailbone is the sacrum. And the craniosacral system involves the bones of the skull, the sacrum, the membranes that encase the nervous system, the central nervous system, the ventricles in the brain, the openings where cerebral spinal fluid flows through and is produced, the cerebral spinal fluid itself, and the structures within the ventricles that produce the cerebral spinal fluid. So that's the craniosacral system, the encasement of the central nervous system.
And what's so important about the cerebral spinal fluid?
The cerebral spinal fluid is very important to life. For one thing, it protects the brain, it encases the structures of the brain, it protects the spinal cord. It carries some nutrients in it and bathes the structures of the brain, the nerves inside the brain. It's also a colloid for distributing other types of nutrients in there and flushing out toxins and getting rid of waste materials in the nervous system. So it's protective housing, but it also provides a lot of nutrition.
So in our practice, we treat a lot of TMJ disorders where the jaw is out of alignment, and that's one of the important joints in the body because the body is a chain. So if the jaw joint is out of alignment, the neck could be out of alignment, causing neck pain, the shoulders, and all the way down to our feet. So is that one of the conditions that can interrupt this cerebral spinal fluid flow and rhythm?
Absolutely, absolutely. And it's great that you mentioned rhythm. That cerebral spinal fluid does have a rhythm. So you can think of it as, most people are familiar with other rhythms of the body, such as the heartbeat, 60 to 80 beats a minute. We have a breath cycle, which is about 15 to 20 breath cycles a minute. You also have another rhythm in the body, and it's a much deeper rhythm, and it's in that craniosacral system. The rhythm is generated by production and draining of cerebral spinal fluid in there, and that's about 6 to 12 cycles of filling and draining of cerebral spinal fluid in the nervous system. So as a therapist, you use that rhythm and you tap into that, and you use a very gentle touch, a very gentle palpation to feel that rhythm. And you can feel that, amazingly enough, anywhere on the body with some practice and training. And you use the information you gather from that, the characteristics of the rhythm, to find restrictions in the system. You can find restrictions in the connective tissues and literally in the bony structures themselves, using gentle techniques to correct any type of restrictions that you find. So that can have a global effect. It can really influence the structures of the musculoskeletal system, muscles, tissues, which in turn will affect a lot of the joints and in turn have an influence over the TMJ.
And I can share with firsthand, I've had several treatments with Charise, and one of the unique things about her training is that she can work inside the mouth. So if we're trying to realign a jaw joint, Charise is trained to move the mouth bones around and work with alignment of the bones. But there's another component that she has that most of us aren't even aware they're experiencing, and that is when our system has been stressed for so long, we can also have emotions that go with that and that get trapped. And so Charise has been trained to also help with some of the negative, or getting the negative emotions out. Do you want to share a little bit about that?
Absolutely. There's an aspect of craniosacral therapy. It's called somato-emotional processing, and soma refers to the body, and body emotions trapped in the tissues of the body. So you can have that from stress. That can be stress-related, trauma-related, and I have training in cranial work that relates to somato-emotional processing. And how you do that in terms of craniosacral therapy is, again, with a light touch, and we use the cranial rhythm to feel what's going on and where there's any type of restrictions again. And it's really a work of intention. It's a work of intention from the therapist, allowing that person's system to relax and rebalance. And as it's doing that, emotions can come up. There can be dialogue involved in that. And again, the idea that, and the ultimate goal of that is to gain, for the patient to gain self-awareness, to gain insight on what some of those problems are. And this is a way to support and assist and encourage them to release and transform those emotions.
Right. To have a whole person and be healed, oftentimes we just think of the physical things that we have, if we have a stomach ache or headaches, but we are also emotional beings, and so Charise's work is very helpful to heal that. And then we are also what we eat. So if we're putting chemicals into our bodies that we shouldn't be, that can affect our health negatively too. So, so in our office, we're trying to touch on all three of those areas by helping patients with their diets, the structure with the appliances, and also the cranial work, and then the emotional side that you're able to provide. And did you want to share a little bit about your instructor training, that you are an instructor for this type of therapy?
Yes, it's very exciting. I'm very excited about it. I've been working with the Craniosacral Therapy Alliance, which is in Stratford, New Hampshire, and I received my advanced level training there and my certification, and so now I'm doing some apprentice instructing with them, and hopefully over the course of a couple of years we're gonna have some classes that are going to be down here in Pennsylvania, so it's going to be a lot of fun.
Awesome. Yes, so Charise is very capable to take care of many physical things that people may be suffering from, and you can find Charise by calling our office. Our number is 610-796-2835, or by emailing the office at info@tmjsleepcenter.com. And Charise also has her own phone number if you wanted to share that.
Yes. You can also schedule with me at 610-406-3309, or check out my website at www.chariserogoskycst.com. That's CHARISEROGOSKYCST.com.
Well, thank you for joining us today, Charise. I know this was very in-depth information, but it connects with the jaw joint health and treatments very well. And thank you everyone for joining us on Your Mouth is the Door to Your Health series. I'm Dr. Tammy Balatgek.